This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Monday, May 15th. This is Africa 54. Due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look a little different today and in the near future as we, out of an abundance of caution, reduce our staffing at VOA headquarters here in Washington. We're working to help keep you informed about what's going on, and we appreciate you staying with us on Africa 54. Support for an independent investigation into the origins of the coronavirus outbreak appears to be growing, but a Chinese foreign ministry spokesman said Monday such a move is premature. A European Union drafted resolution is expected to gain approval this week at the World Health Assembly. The measure calls for a probe into both how the COVID-19 pandemic began as well as the responses to the disease. The United States, the world leader in the number of COVID-19 infections and deaths, with about 1.5 million confirmed cases and 90,000 deaths, is gradually easing restrictions in many parts of the country. Now to Africa, where Nigeria's aviation minister says the country has impounded a plane operated by a British company for allegedly violating a flight ban imposed to prevent the spread of the coronavirus. Passenger flights into the country, with the exception of ones to evacuate people or repatriate Nigerian citizens, have been banned for weeks. Flights for essential services such as the delivery of food supplies and items for humanitarian use are permitted. Egypt is closing shops, beaches and parks during the Eid al-Fitr holiday that marks the end of the holy month of Ramadan, while also instituting a nighttime curfew to prevent the spread of COVID-19. Madagascar has registered its first coronavirus death. The National COVID-19 Task Force says it was a 57-year-old medical worker who suffered from diabetes and high blood pressure. Kenyan President Uhuru Kenyatta on Saturday banned movement across the country's borders with Tanzania and Somalia to help curb the spread of coronavirus. He exempted cargo trucks, but says drivers will still be tested for COVID-19. Kenyan authorities recently locked down the Somali-majority Nairobi neighborhood of EASTLEIGH because of a jump in confirmed coronavirus infections. The restriction of movement was imposed to slow the spread of the virus, but businesses in EASTLEIGH are struggling to get by. Mohamed Yusuf reports from Nairobi.
A second week of lockdown in Nairobi's Somali-majority neighborhood of EASTLEIGH is bringing economic frustration. Grocer Mohamed Said says business is poor as few people are willing or able to shop at his store.
People are not coming to buy foodstuff the way they used to before. There is less movement of people around 4 in the evening. That's when you see a few people around. When I come to shop early in the morning, you regret coming to the shop that early because there are no people.
Said's neighbor, also a food seller, says he may soon go out of business.
Since the lockdown began, our business has gone down, and the lockdown has brought us a lot of losses. We cannot afford to pay rent. We are requesting the government to help whenever it can.
Kenyan authorities closed off the area until May 20th after recording 29 positive tests for the coronavirus on a single day. Authorities are only allowing essential service providers like medics and those delivering food to enter and leave the area.
People here are business people. Some used to receive money from their relatives in Western countries, but now there is nothing. Coronavirus has crippled our people in the West, and the income we were getting from here, it's closed. There is no help. There is no hope.
Kenyan officials say the lockdown is meant to protect the community and reject claims that they were singled out because they are mainly ethnic Somalis.
We are facing this challenge together, and we will succeed if we continue to stand together. It's unfortunate that sometimes that perception can exist, but I came to confirm to you, and believe you me for sure, this is the position of government. There is no effort to target anyone on account of their creed, on account of their ethnic community.
The restriction of movement in the area is expected to end next week, but will depend on the judgment of Kenyan authorities on how well the coronavirus has been contained. Mohamed Yusuf for VOA News, Nairobi.
The COVID-19 pandemic has resulted in school closures across Africa, and the way education is delivered has changed dramatically with the rise of e-learning teaching done remotely and on digital platforms. In Ghana, the Wallo e-learning platform is trying to keep up with the sudden rise in demand for quality and affordable education through the use of digital technology. Africa 54's Paul Ndiho spoke to Joseph Anim, the founder and CEO of Wallo e-learning.
Joseph Anim, welcome to Africa 54.
Thanks very much, Paul. How are you doing, Paul?
I'm great. How are you coping with COVID-19?
Well, COVID-19 hit us just like it hit everyone. It's actually disorganized everything, the economy, education, all aspects of our life. If I have to limit it to education, you know what has happened? We had to shut down all the schools, and ever since our students are home, our children are home, teachers are home, universities are not operating, basic schools are not operating, and it's become a bit of a challenge.
You specialize in e-learning. I wonder how much of an impact it has had on some of the projects that you're working on. Have people taken advantage of the services that you offer?
Yes, we have been planning for about 2-3 years now to roll out an e-learning program, and we've been doing very well. We had gone very far. We had multiple platforms. We had rolled it out already before COVID hit. So when COVID came, we were ready. We were out there. We had developed multiple platforms. We have 2 online and 2 offline. Now, the online ones include a mobile app, a web app, and then the offline one includes, one is a television channel, which is called Joy Learning. We did it in partnership with one of the biggest media houses we have in Ghana. And then we have one we do in the communities. Now, because of the situation with the COVID, the community one cannot operate now, but all the other 3 platforms are operating, doing very well. So naturally, because we're the only platform that was ready out there with content and we were running, when COVID hit, the attention was on us. And thankfully, we've been able to serve some of our students and parents very well.
That's very good news to hear in light of what a lot of people are dealing with. The whole world flipped around, and I'm glad to hear that at least on your part, you're doing very, very well.
So as a country, you can imagine when you are not prepared for something like this, and then something of the magnitude of COVID-19 hits. So it destabilized everything, but the impact was immediate. In our case, we had done a bit of work and developed some content for high schools. We had programs, we have core subjects, and core subjects naturally is taken by every student. We have 1.2 million students who are taking core subjects in Ghana. All of them have content that is ready on our platform. And then the other subjects that we call electives in science, business, general arts, we had them. So you can imagine, we had a spike in the users or the number of users who were already on our platform. And ever since, it's not come down. But then we were overwhelmed. You can imagine a business running, and all of a sudden, all your phone lines are jammed, emails, through social media, everybody making inquiries. Parents who didn't know anything about e-learning they are calling now, they are now asking, they want to know anything that they can find, and that's what the situation has been.
What things have you put in place to make sure that you keep up with the demand? Because you talked about the spike, and I'm sure this is just the beginning.
In terms of capacity, we have a very big capacity, and then currently we are coping with the demand. It's so far been very good. We've not had any technical challenges.
Has government reached out to you to use your service, especially now that COVID is making everybody rethink of how business is done?
We had an engagement with government. They invited us, the Ghana Education Service. We had some encounter with them. So we had discussion with them. It's still ongoing. We are looking at possible collaboration.
What does Wallo mean?
WOLO word actually means book. Because this project is an educational project, so that's the name. WOLO is primarily e-learning.
You've been at this for a couple of years. You keep pushing and pushing. What motivates you?
I saw the media as a weapon that can be used to advance education. But the drive has always been entrepreneurship, trying to solve a problem. So for me, the motivation is looking at the thousands and thousands of students out there who we are providing opportunity to, whether they are in the rural areas or they are in the urban areas, so that they can receive education.
Thank you so much for your time.
Thanks very much, Paul.
That was Africa 54's Paul Ndiho speaking with Joseph Anim, CEO and founder of WOLO e-learning in Accra, Ghana. U.S. President Donald Trump has unveiled Operation Warp Speed, an initiative aimed at developing a coronavirus vaccine by the end of the year. Although he vowed the country would reopen with or without one, the White House has also laid out plans to expand an initiative to ensure the United States does not run out of critical medical supplies. White House correspondent Aziza Kuswara has the story.
Thank you very much.
U.S. President Donald Trump intends to have hundreds of millions of coronavirus vaccine doses available by January 2021.
It's called Operation Warp Speed. That means big and it means fast.
Most public health experts agree it's an ambitious timeline, but they say it may be possible to have a vaccine ready for emergency use on high-risk groups, such as healthcare workers and the elderly.
Everything would have to go perfectly. I think for the general population, we are really still looking at an 18-month endeavor here if all goes well.
With an election looming in November, Trump is also keeping his eye on reopening the country and its economy.
Vaccine or no vaccine, we're back. And we're starting the process. And in many cases, they don't have vaccines, and a virus or a flu comes, and you fight through it.
Trump has expressed support for protesters who want individual states to lift stay-at-home orders and open their economies, though many do not meet his own administration's criteria to do so. Some include so-called red states that voted for Trump in 2016. Analysts say Trump's support for protesters may hurt him politically if states that reopen too early see a rise in the number of coronavirus cases.
It is a big risk to take. And what we're seeing now with cases emerging in rural areas and in places where Trump has been strongest, the red states and the red parts of blue states, suggests that this could be a gambit that could backfire.
Earlier this week, Trump also announced plans to ensure the nation has enough supply of medical and emergency gear.
Instead of 1 to 3 weeks worth of supplies, which we had less than that, the U.S. government will now stockpile 3 whole months, much of it made in the USA.
The Trump administration has been criticized by some for the country's lack of personal protective equipment in the early weeks of the pandemic. Replenishing the strategic national stockpile is seen as critical.
It's really important that we do everything we can now to prepare for a fall or winter pandemic wave when we will likely have both flu as well as COVID-19 at the same time.
The administration plans to expand American manufacturing of these medical supplies to reduce reliance on foreign companies and create jobs domestically. Aziza Kuswara, VOA News, Washington.
The gradual easing of COVID-19 lockdowns appears to be bringing investors back into markets as Asian and European markets begin the week on the rise. Tokyo's Nikkei index closed 0.4% higher, despite news earlier in the day that Japan had technically fallen into recession for the first time since 2010 after 2 straight quarters of contraction. The indexes in Hong Kong, Seoul, Shanghai, and Sydney also ended in positive territory, while Taipei dropped 0.6%. The positive trend has spilled over into Europe as London's FTSE is up 2.6%, the CAC 40 in Paris has gained 2.4%, and the DAX index in Frankfurt has soared 2.8%. We're excited to hear what you think about Africa 54 and the stories we cover. Join the discussion on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Also check out our headlines 24/7 on voaafrica.com. Still to come, coronavirus keeps on hold the dreams of the South African gymnast Rooskrantz, but she sees a silver lining. We'll be right back after this break.
People, now you ready to ride? Few kids, I do.
Welcome back to Africa 54. U.S.-backed local authorities in eastern Syria's al-Hasakah area say they are bracing for a possible coronavirus outbreak in an AL-HOL refugee camp where thousands of Islamic State families are being detained. The authorities say Islamic State wives are rejecting protective measures for religious reasons. VOA's Zaina Omar has this report narrated by Nissan Amado.
Kurdish officials have imposed strict protective measures at the AL-HOL camp to prevent the outbreak of the coronavirus. Those authorities say among the thousands of Islamic State families being held there, some women are defying the orders, saying the virus is part of God's wrath against infidels.
We sent many pleas to international organizations to help us secure the AL-HOL camp, but their response is very slow and plans to protect the camp are late.
There are an estimated 100,000 refugees living in 10 sprawling camps in northeastern Syria. AL-HOL is the biggest of them, with 70,000 refugees, including thousands of IS relatives. One of the camp's sections holds foreign IS families, while the other hosts Syrian and Iraqi IS families. A lack of medical facilities could put the camp at a higher risk.
There's a dire need for more ambulatory care units and medication in the camp. We have 2 outpatient care units. There are plans to create an isolation section.
So far, Syria has 48 confirmed COVID-19 cases, with at least 3 deaths. One of them in the northeastern region where AL-HOL refugee camp is located. For Zana Omar in AL-HOL camp in northeastern Syria, Nisan Ahmado, VOA News, Washington.
Muslims abstain from eating and drinking during daylight hours in the month of Ramadan, which ends on May 23rd. After sunset, they enjoy a meal and celebration known as Iftar. Much of the celebrating this year is taking place in homes and online because of COVID-19. As Michael Sullivan reports, one online event has brought together people from 2 faiths, which are sometimes antagonistic towards each other.
In this time of isolation, the breaking of a fast is done at home.
Allahu Akbar, Allahu Akbar.
And this year, the communal celebration is also held online, in one case with an interfaith flavor. An imam from a Los Angeles mosque joined the virtual gathering with a rabbi.
Adonai Rohi Lo Echsar.
As hundreds joined from home via Facebook.
And the whole idea was that we can still learn and nurture each other and connect with one another, even if we're not doing it in the same space together. We prefer the same space, but that's not possible.
Since 2006, NEWGROUND, which sponsored the online iftar, has promoted dialogue between Muslims and Jews. During the COVID crisis, it has engaged in a blood drive and other joint projects. The aim is to bridge the gap that divides the communities, a gap that often stems from violence in the Middle East.
We make the choice to work through the conflict, whatever that may be, that it's not intractable no matter our histories, and that we can transform our communities through the power of relationship.
a Jewish composer who co-created the theme song and hit single I'll Be There For You for the Friends television series, adapted the song for the online iftar.
And people think of it as like this bubbly, high-energy song, but the truth is those lyrics are very touching.
Especially relevant now, he says, in this time of pandemic.
To express to people that regardless of your religion and race and culture and political leanings, we're all in this together.
Mike O'Sullivan, VOA News, Los Angeles.
I'll be there for you.
China is touting its success in curbing its outbreak of COVID-19 that has now spread to the rest of the world. But the so-called success came at a steep price. The state's massive surveillance network now intrudes even further into people's lives with more crackdowns on speech and more government critics in prison. Beijing argues the hardline measures are necessary, but other countries show such extreme measures may not be necessary. VOA's Nike Ching has more.
Around the world, many popular landmarks and streets remain empty due to restrictions amid the COVID-19 outbreak. Yet in some places, schools, offices, and restaurants are gradually reopening, including in China, once the world's coronavirus epicenter. U.S. President Donald Trump initially praised Beijing's response to the outbreak, but as the virus spread and more Americans died, Washington accused China of hiding key information about the origins of the coronavirus. China rejects the criticism and points to its support of the World Health Organization in fighting the pandemic. U.S. Secretary of State Mike Pompeo says this assertion ignores how Beijing continues to undermine the global effort.
We still don't have the samples that we need. We still don't have the access. We collectively, the world, don't have the samples to be. It's not even just that in the moment they couldn't do the right thing. They continue to be opaque. They continue to deny access for this important information that our researchers, our epidemiologists need. And importantly, this could happen again.
Beijing insists it is cooperating and being transparent, even though it has not allowed international scientists access to the Wuhan virology lab and other places that may have played a role in igniting the pandemic.
For some time, the U.S. government has ignored the facts, diverted public attention, and passed the buck in an attempt to shirk its responsibility for incompetence in the fight against the epidemic. This approach will not erase Chinese people's achievements in the epidemic prevention and control through hard work.
China positions itself as the leader to fight the pandemic, but the achievements to control the coronavirus are not Beijing's alone. Some senior U.S. officials say democratic governments like Taiwan are examples of how authorities can effectively respond without undermining individual rights. Retired Brigadier General Robert Spalding from the Hudson Institute spoke to VOA via Skype.
When you look at the way that they've taken care of their population by providing information and transparency and also acting quickly as a government to implement the kind of controls and protections, Taiwan's actually fared through the virus very well, and they've really given, I think, the world a model.
Taiwan uses air and sea border controls, quickly identifies new cases, notifies others with real-time alerts, and has used funds and military personnel to increase mask production. For its part, China has provided millions of test kits and protective gear for countries battling the virus, diplomatic outreach that some say has been helpful, despite some complaints over faulty equipment. And as vaccine development gets underway, the country expects to be a part of the solution, says Chinese entrepreneur and philanthropist Jack Ma.
In my opinion, the epidemic will not end within a short time, and it can only vanish by relying on technological breakthroughs, innovation, and medical research. So we have to make long-term preparation.
But others say Beijing's aid has not made up for its failures. Bonnie Glazer from CSIS spoke to VOA via Skype.
I think the countries have not forgotten the mishandling by China of the outbreak of the crisis, its cover-up of doctors within China, its domination of the World Health Organization, its failure to share completely transparent information with the rest of the world. So over the longer run, I actually think it's going to have a negative impact on China's reputation.
Now China and other countries are battling a new wave of coronavirus infections, putting their pandemic response systems and their political systems to another test. For Nike Ching, I'm Elizabeth Cherneff for VOA News.
In our sports news, South African gymnast Rooskrantz was looking forward to living her childhood dream of representing her country at this year's Olympics in Tokyo. Then the unthinkable happened. The coronavirus pandemic forced a year-long delay of the Tokyo Games. It was a shock and a serious challenge for Rooskrantz, but also a mixed blessing. She spoke to VOA's Anita Powell in Johannesburg.
At the beginning of this year, Rooskrantz was flying high. The 18-year-old had just become the first woman since 2004 to represent South African artistic gymnastics at the Olympics. Rooskrantz ramped up her training in anticipation of the Games. But then, the global coronavirus pandemic took over, and the International Olympic Committee postponed the Games until 2021.
Yeah, like I said, it was a really big shocker to me, but if you think about it deeper, it is at the best interest of all the athletes, it's for the best of our health. So, and if you look, you always try and look for the positive in everything, and it's bumped a whole year later, so now we do have more time to prepare.
The Olympic delay came just days before South Africa began a 5-week coronavirus lockdown, which included closing all gyms in an attempt to slow the spread. Gone are the daily 8 hours of training at the Johannesburg Gymnastics Center. Now she trains at home for about 3.5 hours each day.
I'm really hoping that in this year, that now before the Olympics, that my main goal is definitely to stay injury-free, keep that out of the picture, and just really focus on trying to upgrade my skills.
But the hardest thing, she says, is something everyone can identify with going through this pandemic: the isolation.
Since I can remember, I've been training for 6 days a week, every week, and I see them every day. They are literally like family to me, so to be able to have not seen them for, I think it's going on maybe 7-8 weeks now, it's really hard.
Olympians, they're just like us. Okay, they're also extremely skilled and hardworking athletes. And in these difficult times, their Olympic dreams may be delayed, but they're still very much alive. Anita Powell, VOA News, Johannesburg.
And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, thanks for watching.